Okay. Hi everyone, I'm Natalie. I'm here with Dr. Maryam, who is the inventor of the BLAlip appliance, otherwise known as the BLAfit. It's a facial fitness device that for just 1 minute a day, you can achieve beautiful plump lips, defined jawline, and lifted cheekbones. So it's the best non-invasive tool out on the market to achieve surgical results.
Non-invasively and inexpensively.
Precisely. So today we're going to talk about how you can incorporate BLAfit into your everyday routine. It's not as complicated as it looks. It's a very simple and ergonomic design, but this BLAfit, this product actually comes with a complimentary Zoom training to teach you how to best use your device and get the best results, because oftentimes people say, well, this device doesn't work. I'm like, well, did you get your training? The training helps so much. I just got off 2 Zoom trainings earlier today, and they were just so grateful. They found the training to be so helpful, and they're like, wow, I learned so much. And I'm like, you see, I'm so glad I took advantage of this opportunity, because oftentimes people don't. So we'll teach you how to best use it, how to use it correctly, and where and when you should be using your BLAfit.
And it's tailored to everybody's needs. And if they have TMJ problem, if they have jaw tightness, if they get headaches, or if it's just for the beauty and fitness.
Exactly. So that's another thing that a lot of people ask is people say, well, this doesn't look like it would be healthy for my jaw if I have TMJ. This looks like it would worsen my TMJ. This looks like it would just make me feel worse. Can you elaborate a little bit more? By the way, before you say anything, she has been specializing in TMJ for over 30 years. This woman right here is a TMJ specialist. For anyone to say that this device is gonna harm their TMJ after this is her whole life, her whole research and knowledge has gone behind the BLAfit. I would trust her, what she's about to say, so.
Hello everybody, it's an odd day for us to get together. It's a Friday. I'm going to be off Monday for those of you that follow us on Mondays, because I'm helping somebody with their cancer and taking them to chemotherapy and bringing them back, so it wouldn't work. So now we're fitting this Zoom live in our lunch hour. I just ate my food and came back. So and Natalie's been on the mood today. She's been training all day long, so she's and I'm pretty slow. I just had food in my tummy, so I apologize ahead of time. Yes, any type of a mouth exercising device that's out there is not good for TMJ. Some would not hurt TMJ. A lot of the devices that are out on Amazon or on social media really scare me as a TMJ specialist, that people put that in their mouth. And I see more TMJ clinicians on their Instagram talking about some of the appliances that are out there. BLAlip appliance was invented by me, and as a TMJ specialist, a diplomat of craniofacial pain, sleep specialist, and orthodontics specialist, I know the jaw and the facial muscles and the anatomy that goes behind it. So that is why training you is very essential to this whole dynamic and training and learning. It's I go to a gym and I don't know how to use any of the instruments or the machines, and if there's not a trainer around to give me the instructions, I'm just going to do something that could hurt my muscles or my back. The same thing goes with any tool that goes in your mouth. Mm-hmm. Our facial structure is a very important region in our overall health and body. So let me just give you a little rundown first before I go into BLA. First of all, one thing that you will learn in our one-to-one training, I was in my room hearing Natalie in another room because she trains, and that she was talking about facial anatomy. One thing you will learn that we teach you what BLA does, and where the anatomy will show you sketches of anatomical sketches and so forth, and we look at what your needs are, and then based on those needs, sometimes I come in, but in majority of the times that are not sophisticated, Natalie is capable of giving you the instructions that needs to be done. But let me have that 2D shot. And I know you guys seen this in our Instagram, in our TikTok, and I've talked about this structure before. I want you to remember, look at what passes behind the lower jaw. We've got a very complex neurovasculature that goes to our face, and most of it arises right in front of your ear, and then it just feeds our facial structure, our neck, back of our head, the side of our skull. And if things goes in this mouth and is not done correctly and it pushes the jaw back, we're actually hurting our head by constricting that blood supply. And patients are doing these exercises, not my appliance per se, but there's appliances that are out there that they really advertise on their face sculpting orthotics, exercising devices, and I get goosebumps when I watch people put it in their mouth because it actually pushes the jaw back. So now if you have TMJ, which is 90+% of us have some sort of a TMJ, we're actually hurting the jaw joint, but not knowing what we're doing. And then the patient walks around, now they're dizzy, they have migraine, they have headache, but they have a much more sculpted face, but they're more sick. So it's very important that the orthotic that you put in your mouth is done by a physician or a dentist, somebody that's in that area and knows the neurovasculature, knows the facial anatomy while they're constructing it. With BLAfit appliance, we learn when it goes in the mouth, if we just do normal exercise, meaning that the vertical exercise, if it just goes up and down, it doesn't hurt the TMJ, but we're really not changing much about TMJ. If we want to have a positive impact to our TMJ, if somebody has headaches or jaw clicking or facial tightness in the morning, which is the majority of us, we want, when we're opening and closing the device, we want to shift this lower jaw outward, opening all that. That's how we improve TMJ. That's how we improve the facial circulation. That's how we stretch that clenching muscle. And it's like a physical therapy modality that you can do at home. It's only done 1 to 2 minutes a day, so it's very short time of your daily schedule. But we will train you. Take advantage of the training. The training is the most expensive part of the treatment, and we're not even charging for it. So it's something that I felt that if it's not done on Zoom, patients may do crazy things with their appliance and they don't know what they have to do. So you have to be trained. We will train you at no charge. We will take at least 20 minutes average on our training to teach you, to make sure you're doing it correctly. You can come back again and retrain if you need to, but please take advantage of that.
Someone asked, they got in here a little too late, what did you say helps with jaw clicking?
Well, when you do the BLAfit appliance exercise, so this is a BLAfit appliance that I invented. It's an exercising device that helps the jaw, the clicking, also lifts your cheekbones and makes it more prominent cheekbones. So when you're putting makeup, applying makeup, it looks better. It also lifts the facial muscles. At the same time, it treats and helps your TMJ and your clenched muscle. So that's what we were talking about. When you click, there's a disc here that displaces. And if you get that lower jaw extension forwarded, the disc could go back into its place and tighten up. For those jaw clickers, this treatment is not to improve your clicking or TMJ, but we know when you're exercising with BLAfit appliance, patients have reported that their clicking is reduced and their facial muscles is much more relaxed. So it's not for sake a treatment for TMJ, but if you have TMJ and you're doing these facial exercises, it really helps your jaw overall feeling, overall function, and your facial muscles to balance at the same time to relax.
Yeah.
So you're lifting some muscles, relaxing some other muscles that we're clenching all night long, retraining the disc to go back by tightening a muscle called lateral pterygoid. So there's a lot of little things that goes along with the exercising device, but for your sake, you will get the training from us. So you don't have to worry about that. Once I meet you one-to-one, or Natalie, we'll look at your mouth over Zoom and we'll tell you how to do it and what exercises best benefits you.
Exactly. So that's the science aspect of it. That's how it can help if you have TMJ. And as Dr. Maryam said, BLAfit appliance is not a solution treatment that's going to resolve your TMJ issues. It's simply something that she recommends in conjunction with TMJ treatment from a professional, or if you don't have the means to have the professional treatment, this can help to alleviate those symptoms.
Yes, so what happens is a temporomandibular joint disorder, which is TMJ patients, which have clicking, locked jaw, tension, headaches, and goes on and on. The treatment is to make an appliance. They make orthodontics for you that costs you $3,000 to $5,000 in average to shift the jaw forward. But BLAfit appliance was made, it was for the beauty and the fitness, and it's kind of like a physical therapy or yoga for your face. We will train you how to do the exercises if you have clicking, or if you're locking, how to do the exercises to it helps you with those symptoms. It's going to alleviate some of that symptoms, not necessarily permanently, but while you do the exercise, it's kind of like you do a yoga. When you do the yoga and you do the breath work, it just calms you that moment, right? But then if you continue on life and running around, you're not always calm because you did a yoga an hour ago. Yoga is just puts you in the center and gets your body and mind and soul all like calm and put in the Zen position. With BLAfit appliance, we'll train you to do that yoga or physical therapy exercise depending to what your needs are. If it's just beauty and fitness, you don't have any jaw issues, then we'll train you for that. But if you do have jaw issues and you still want the lifting and the tightening, then we will train you for that.
I think it would be great if you could actually demonstrate the vertical exercise for those who are not really familiar with the BLAfit appliance.
So for those of you that just joined us, let me just give you a really quick rundown on anatomy. What we have, I think this shot would show both cameras.
Yeah.
What we have is our lower jaw, our upper jaw. Our lower jaw is a movable jaw. You open and close, we go side to side with the lower jaw. Look what passes behind the lower jaw, your major blood supply, nerve and artery that comes from your heart to the brain or to the side of skull. It's very crucial for us not to clench. When we clench and grind our teeth, we're moving the lower jaw back, constricting this blood supply, which causes temporal headaches, a migraine, jaw pain, tension in the muscles. And with the BLAfit appliance, this vertical exercise that we created, we're actually going to make the jaw, lower jaw, shift forward and open all of that. Put the whole brain and our body in a system where it's not nervous. It's not in sympathetic nervous system drive. So we're doing two things: helping the jaw, opening the roadmap for the brain. At that time, your brain feels like, the blood, oxygen, everything is flowing. I'm not tense. We're stretching the clenching muscle by holding it in, and we're tightening other muscles that we usually don't use because we're not eating or chewing our food. We're drinking our food most of the time. We either have cooked, overcooked meal or juicing and drinking shakes. So we're not using some of the facial muscles and we're sagging and they're becoming pretty flat. So we're gonna lift those up. So this is my favorite exercise in the universe. By the way, everything about BLA looks simple, but everything is calculated measures. Like this is how much I want a normal patient to be able to open. That's a maximum range of opening on a normal patient. The weight training that we're doing with the facial muscles, this little band is the perfect weight training without causing TMJ. So we're weight training our facial muscle by lifting. We're shifting the lower jaw forward to open that circulation, and we're adding breath work to put the whole system in a yoga Zen mode. So let's do all of that.
Yes. I'm just going to go ahead and describe what she's doing. So both of the handles are going to anchor only onto the soft tissue, her lips. There's no teeth involvement with the vertical or the horizontal exercise. Then she's going to open up as wide as the BLA allows her to. I'm going to hold on to the resistance band with her forefinger and her thumb. As she closes, she's going to engage both the upper and the lower lip to bring the handles together, simultaneously taking a deep breath in from her nose and shifting that lower jaw forward. So this is what Dr. Maryam was talking about earlier. When you shift your lower jaw forward, now you're opening up that roadmap to allow more blood flow, more airflow to circulate through your brain and your facial muscles to help bring more circulation and relax the brain. So all of these movements are slow and controlled. She's exhaling as she's opening back up to the original starting position. Taking a deep breath in from her nose. It's really important that it's nasal breathing. And then closing and bringing those handles together, simultaneously shifting that lower jaw forward. So this is going to have more neck engagement. This is going to bring that jawline definition, while also alleviating those symptoms that you may be experiencing from your TMJ disorder. If you're clenching your masseter muscles, this masseter muscle in particular will probably feel very tight from excessive clenching. So when you do the vertical exercise, it's going to feel so nice to help stretch out that muscle and alleviate that tension. And that's the vertical exercise.
So I feel my upper lip and lower lip are plumper and they're rolled because I worked out those muscles. Also, I feel tightness in my neck and my cheekbones, but at the same time, all those muscles are tightening. The beauty of the BLAfit appliance is because I moved the jaw forward and I held it forward with the weight training that I was doing, I had a rush of blood supply, nerve and artery to my brain. So my brain feels quiet, calm. Like right now, I can just sit back and relax and enjoy Natalie talking. Because that breath work, all day, we started early in the morning in my practice. This is our lunch hour. We have, in a few minutes, we're gonna start our afternoon patients. So I was running around all day, so I didn't get a chance to sit down and actually take the breath work. But when I just did these 2 or 3 exercises that I just did, I feel like I'm actually in a much more Zen mode, and I'm not acting. For those of you that have a BLAfit appliance, follow me and you will agree with hundreds of other customers that this is what you feel when you're trained and you're able to take advantage of the BLAfit appliance. 100%. You're spending $85 on an appliance that's durable. We will do the training for you. It's gonna last you a few years. And you only need to do it 2 minutes a day. And with all that backup and customer service and Zoom training, and I mean, I cannot tell you enough about this product, and I don't know any other product that's out there where the founder actually sits behind it and backs it up. So I'm here. This product is made in USA. Every part of it, from the color to the nylon that's used, all of them are FDA quality products. So there's nothing that's plasticky, that's junky. That's why our testing shows 400,000 cycles would not even crack the product. So it's a very durable product. You can just rinse it, it's yours. So it's up to you how you want to have the hygiene, but you just restore it in its case just like that. Do you have your case?
Yeah, so it comes with a nice case here.
It comes with a portable case where you can just leave it open like that, and you put it in your purse, you put it in your gym bag, you can put it in your car, however you want to do. There's so many places, so many ways you can use BLAfit appliance. This was my favorite exercise. I do this maybe 3 repetitions at night. I only do the vertical exercise at night before I sleep, and it just gets me ready to go to bed, puts my system in a calm, relaxing mode. I do this in the dark while I'm in my bed, and I have one right by my bedside. I get to have many of them everywhere so that I could learn more about it, so I could teach you. This last 2 years, I've learned so much more different ways of doing it so that I could improve the quality of your life and mine and my family's.
I also like to always share how I like to use the BLA in my experience, because I'm a very active person. I really like to weight train, and I know a lot more women have finally like started weight training as well. Or even if you're not, even if you're
you can tell by looking at her that she is really fit.
Even if you're just like an active person, like you run or you walk or you do yoga, whatever the case is, if you're moving your body around, I think it's always really important to incorporate a cool down with any activity. And so usually my cool downs are just breathing. It's just bringing my body back to its natural heart rest state, because I'm getting my heart accelerated when I'm active. And so you just want to bring that heart rate down when you're cooling down. And the best way to do that is to just practice breathing, like just practice breath work. And I was already doing breath work for like 2 minutes for my cool down, but then when I discovered BLAfit and I started adding BLAfit to my cool down, it honestly just changed the game for me. Mm-hmm. It just feels really good. Especially because I like to do my cool down when I'm laying down flat on the ground, and I prop my legs up on a 90-degree angle onto the bench. So the only thing that's flat on the ground is my back, and then my legs are up on a bench. And then I just practice the BLAfit. So it's really different doing the BLAfit when you're on your back as opposed to just sitting up or standing. But it feels really good. Like, it feels very nice. It's hard to describe, but I'd really highly encourage you guys to take this with you to the gym or to the yoga studio and just practice breath work combined with the BLAfit. Like, you will feel brand new afterwards.
This almost feels so real. I mean, this is like, how could an appliance do so much?
I know.
Well, because I am that way. I treat my patients here like my family, and I go beyond and above for them. And I wanted to have a product that has my name behind it, that does so much, that leaves a legacy behind. I really think every person in this world, from a 15-year-old, 14-year-old that understands face and wants to look pretty and wants to prevent aging, to get into exercising with BLAlip appliance until the age of 90. If you want to be able to increase circulation to our brain, reduce brain changes, BLAlip appliance will do that. It does the forwarding that we do with expensive appliances. You could do it if you have migraine. You could do it 2-3 times a day when the migraine is coming in. Just do that exercise, and you'll see how you rush the blood and your migraine is going to be reduced. So there's so many different indications that we're learning from patients' feedback that I can't just sit and tell you all of it. But when you meet with us over the Zoom, for now we have one-to-one Zoom training. We will answer your questions as much as we can. And if there's a question that Natalie doesn't know, she'll always calls me in, and I'll be able to help you guys.
Usually that's more like the scientific questions, like the TMJ related questions. I like to have the actual specialist come in and answer that. I mean, I've learned so much from Dr. Maryam that I can kind of, answer some general questions, but when they get a little too specific, I have to ask Dr. Maryam, because she's obviously the specialist and has been doing this for more than half her life. So
half of my life, that means I'm 60, and I'm not 60.
You're not 60. I said more than half of your life.
That means I'm older. Oh, more than half.
More
of
than
my
half
life.
of it.
Okay, yes,
you have been practicing your TMJ.
Yes. Well, I just turned 5 months ago. I in January I'll be 56, which is 5 months from now.
You're not 60.
I'm 56. I'll be 56.
So I think that's the most amazing thing about BLAfit, is that it's not just for aesthetic purposes. It's really just the fact that there's so much research and science behind it, and knowing that it's also good for your overall health. So this is why a lot of our target audience is mostly people that, really believe in non-invasive procedures and value a holistic lifestyle. For those of us that don't believe in like surgeries and fillers, and not that there's anything wrong with that, like anyone can do whatever they want to their body, but if you believe that it's better to just lead a holistic and non-invasive life, then BLAfit appliance will align perfectly with your values.
I agree.
So
I think we could go now.
yeah, so we're gonna go ahead and end right there, but thanks everyone for joining us. If you have any questions, feel free to send us an email. Our email is order@blafit.com, or you can always reach out to us via social media or Amazon, of course. We're always here. We want people to make educated purchases, and we're more than confident that BLAfit is something that everyone should have, no matter who you are. But yeah, so if you have any questions, we'll be here next week as well. So bye everyone.
Bye everybody. Have a blessed weekend. Take care.
Okay, ending live stream.
That was good.
Yeah, it was a nice live.